Assalamualaikum warahmatullahi wabarakatuh. My name is Nur Aiman Hakim, and today, me and my team would like to give you a little exposure about lactose intolerance. But before we begin, lactose intolerance is actually a topic that is covered under Chapter 11, which is Diseases of Digestive System. So without further ado, let's start with a brief introduction about lactose intolerance. Well, firstly, lactose intolerance is a common digestive disorder characterized by the body's inability to fully digest lactose, a sugar found in milk and also dairy products. This condition arises when the small intestine lacks an enzyme called lactase, which is essential for breaking down lactose into simpler sugars, glucose and also galactose, that can be easily absorbed into the bloodstream. So, without sufficient lactase, indigested lactose moves into the colon where it ferments and produces various gases and acids. This fermentation process often leads to symptoms such as bloating, gas, abdominal pain, and diarrhea, and shortly after consuming lactose-containing foods or beverages. Lactose intolerance varies in severity among individuals, with some people able to tolerate small amounts of lactose without discomfort, while others might experience symptoms even with minimal intake. It is important to note that lactose intolerance is distinct from a milk allergy, which is an immune system response to proteins in milk and can cause more severe reactions. So let's listen to a further explanation about this condition by my fellow friends.
As for my part, I will talk to you about the symptoms and the causes of lactose intolerance. Firstly, the symptoms of lactose intolerance is tummy pain or discomfort. Tummy pain or abdominal pain is a common symptom associated with lactose intolerance. It's because of incomplete digestion. Lactose intolerance occurs when the body lacks an enzyme called lactase, which is needed to break down lactose into simpler sugars, which are glucose and galactose. Without enough lactose remains undigested in the small intestines. Moreover, the second symptom is bloating. Bloating occurs as a result of the body's inability to properly digest lactose, a sugar found in milk and dairy products. The production of gas in the small intestine contributes to bloating. The accumulation of gas can cause the abdomen to feel distended and full. After that is farting. Farting occurs as a result of the body's inability to fully digest lactose, leading to fermentation of undigested lactose by bacteria in the colon. The accumulated gases in the colon need to be released, and this is often done through flatulence. Increased gas production results in more frequent and noticeable episodes of passing gas. After that, diarrhea and constipation. Diarrhea can cause harder stools. The colon may absorb more water than usual, resulting in harder stools that are difficult to pass. Also, the fermentation process in the colon can show down gut mobility, leading to reduced frequency of bowel movements. And lastly, for the symptoms of lactose intolerance is feeling sick or being sick. Feeling sick or experiencing nausea and vomiting can be symptoms associated with lactose intolerance, though they are less than other symptoms like bloating, diarrhea, and flatulence. After that, I will explain to you about the causes of the lactose intolerance. Inability to digest lactose is primarily due to a deficiency of enzyme lactase, which is needed to break down lactose into simpler sugars, which are glucose and galactose, that can be absorbed into the bloodstream. There are several causes of lactose intolerance, which are, firstly, primary lactose intolerance. The most common causes of lactose intolerance is genetic. In some populations, the production of lactase decreases naturally with age, leading to a reduced ability to digest lactose. This is often referred to as primary lactose intolerance. Moreover, secondary lactose intolerance. Secondary lactose intolerance causes infections that infect the gastrointestinal tract that can lead to temporary lactose intolerance, as for example, a viral or bacterial infection may temporarily reduce lactase production. After that, developmental lactase deficiency. Developmental lactase deficiency may be because of premature birth. Babies born prematurely may have lower levels of lactase because lactase production increases in the later stage of fetal development. After that, congenital lactase deficiency. Some individuals are born with genetic mutations that severely impairs the production of lactase, resulting in congenital lactase deficiency. This is a rare condition. Finally, ethnic and racial factors. Lactose intolerance is more common in certain ethnic groups such as East Asian, Africans, and Native American populations compared to people of Northern European descent.
Treatment for lactose intolerance. In people with lactose intolerance caused by an underlying condition, treating the condition might restore the body's ability to digest lactose. Although that process can take months, for other causes, you might avoid the discomfort of lactose intolerance by following a low lactose diet. To lower the amount of lactose in your diet, you can limit milk and other dairy products, including small servings of dairy products in your regular meals. Eat and drink lactose-reduced ice cream and milk, and lastly, add a liquid or powder lactase enzyme to milk to break down the lactose. As for the effect from the lactose intolerance, it can lead to diarrhea, which may lead to effects such as malnutrition, unexplained weight loss, and anemia. It may also cause dehydration or acute kidney injury if the intestine cannot absorb enough fluids. Additionally, someone with lactose intolerance who only gets calcium from dairy products may risk their bone health.
For the patient profile, the name is Sarah Thompson. She is 28 years old. Her occupation is marketing executive, and her medical history, no significant chronic illness, occasional digestive discomfort report. As for her case, Sarah Thompson visited her primary care physician, Dr. Rodriguez, complaining of recurrent abdominal pain, bloating, and diarrhea after consuming dairy products. She reported experiencing these symptoms intermittently for the past 6 months, especially after meals containing milk, ice cream, and cheese. Sarah had attempted to manage her symptoms by avoiding dairy, but wanted a definitive diagnosis and guidance on managing her condition. As for the clinical assessment, during the consultation, Dr. Rodriguez conducted a thorough medical history and physical examination. Noting the recurrent nature of Sarah's symptoms and the correlation with dairy consumption, Dr. Rodriguez suspected lactose intolerance. The physician ordered laboratory tests, including a hydrogen breath test, to confirm the diagnosis and rule out other gastrointestinal conditions. As for the follow-up, Sarah was scheduled for a follow-up appointment after 6 weeks to assess the effectiveness of the treatment plan. During the follow-up, she reported a significant reduction in symptoms, indicating successful management of lactose intolerance. Dr. Rodriguez provided ongoing support and education to ensure Sarah's continued adherence to the dietary and treatment recommendation. As for the conclusion, this case study highlights the importance of a thorough clinical assessment and diagnostic testing in identifying lactose intolerance. A multidisciplinary approach, including dietary modification and symptom management, proved effective in improving the patient's quality of life. ongoing monitoring and patient education play crucial roles in the long-term management of lactose intolerance. I think that's all from me. Thank you.